What is wrong with your dad?
My dad complains of having abdominal pain, difficulty in breathing, and had nausea.
What is your dad's name?
James,
How old is he?
68 years old.
Is he working?
No, he is pensioner.
What is his nationality?
Russian.
Where does he live?
Kalamaksa.
What is his main complaint?
He has pain in abdomen everywhere.
Is there any other complaints such as difficulty in breathing?
Yes, he has.
Did he vomit?
Yes, 3 times.
Does he feel weak or fatigue?
Yes, he did.
Does he have fever?
Yes.
Does his appetite normal?
No.
Did he use bathroom normally?
No, he didn't use bathroom for 2 days.
When did the pain started? 3 days ago.
3 days ago, but we didn't go to hospital.
Did he take any medication?
Yes, he take diclofenac for 3 days.
Did he ever have trauma?
No.
Did he have normal urination?
No.
Any allergies?
Yes, to Novocaine injection.
Did he have gastric ulcer?
No.
Did he have blood transfusion?
No.
Does he smoke?
Yes, 1 pack a day since 40 years old.
Did he have diabetes mellitus?
Yes, for 4 years.
Did he have operation?
No.
Did he have TB?
No.
Any alcohol or drug abuse?
No.
Any family history of disease?
No.
Does he ever have stroke?
Yes, he did.
Does he have myocardial infarction?
Yes, 4 years ago.
Any childhood disease?
No.
Conclusion, this patient have gastric dysfunction, respiratory dysfunction, and hepatic dysfunction. Can you open your eyes, sir? Can you flex your arm? Do you know where you are? Can you open your mouth? Can you pull out your tongue? Okay, so this patient condition is severe. His GCS scale is 13. He looks older. His skin is greenish and yellowish. His mucous membrane is dry, and we can conclude that he have hepatic dysfunction and hypovolemia. Okay, right now we are going to do objective examination for respiratory system. Right now we are going to do inspection. Okay, we did the inspection and now we will do the palpation. Do you feel pain?
No.
Do you feel pain?
No.
Do you feel pain?
No.
The patient has no pain, and then right now we will do percussion. Patient has dullness in the lower part. Right now we will do the auscultation. From the auscultation, we can hear crackle and wheezing sound. So now we can conclude that the patient have respiratory dysfunction. Okay, right now we are going to do objective examination on cardiovascular system. Right now we will do inspection first. And then we will take the patient's blood pressure using sphygmomanometer. Right now we will do auscultation. From the auscultation, we found the vague sound, and now we can conclude that this patient have cardiovascular dysfunction. Now we will do the objective examination for GIT. Right now we will do the palpation. Do you feel pain?
Yes.
Do you feel pain? Do you feel pain? Do you feel pain? Do you feel pain? The patient is having pain everywhere in the abdominal area. Right now we will do the percussion.
Based on the information that we have collected, we can make a primary diagnosis stating that there is a non-infectious multiple organ dysfunction syndrome with hypovolemia that includes respiratory, cardiovascular, CNS, liver and renal dysfunctions. Hypovolemia occurs due to hemorrhage in the body, vomiting, and also respiratory loss. The patient did not eat or drink, so there is no way of replenishment of the lost fluid in the body. Inflammation is present, but it is not due to infections. Instead, it is due to shock. This is because when the patient is in shock, there is a low profusion of oxygen, causing damage to the tissues. In this case, the patient has been in this state for 3 days. So those damaged tissues have been releasing pro-inflammatory mediators and also dead products. This causes a systemic inflammatory response syndrome, also known as SIRS. So coming back to the primary diagnosis, there is respiratory dysfunction as a result secondary to systemic inflammatory response syndrome. There is also cardiovascular dysfunction showing tachycardia and hypotension due to hypovolemia. CNS dysfunction resulting from fluid loss and SRS. Same goes to liver dysfunction, which is due to lack of oxygen to the liver cells, causing damage. There is also pre-renal dysfunction as it arises due to shock. In conclusion, there is secondary respiratory failure resulting from lasting, non-treated shock. There is low pressure pulmonary edema due to raise in vascular permeability and also fluid movement. There is cardiac dysfunction due to hypovolemia, hepatic dysfunction as a result of ischemia, and gastrointestinal dysfunction due to ischemic changes in the tissues. As mentioned before, the patient has pre-renal dysfunction due to hypertension and hypovolemia. CNS dysfunction occurs due to reduced oxygen to the brain and circulation of systemic toxins. In general, the patient has MODS, which involves 8 systems. All these are a result of abdominal aneurysm rupture that is untreated and leads to hypovolemic shock, which is also untreated, and causing systemic inflammatory response syndrome and multiple organ dysfunction syndrome. For treatment, the patient is required to be in intensive care unit, placement of urinary catheter to monitor urine output, monitoring of oxygen and carbon dioxide partial pressure, oxygen therapy, IV access for infusion therapy with 3000 milliliters of normal saline and 3000 milliliters of lactate ringer solution over the course of 1 to 2 hours to replenish fluids and electrolytes lost in the body, and also to treat hypovolemia.